Thank you, Asta. Lovely presentation, Emily, Richard, Davina. Thank you for laying the foundations for what Sahil and I will be talking about so beautifully. I'm Erin Michalak. My background is Polish. I'm a professor of psychiatry at UBC, and a mini farm, hobby farm and owner and animal lover.
And good morning, everyone. Good afternoon, good evening, depending on where you're joining in from. My name is Sahil Kanani, and I'm quite privileged to be joining this virtual space today as well. I'll briefly be sharing a couple of pictures, and my name originates from the Farsi language, which represents where the land meets the water. And so I think the pictures that I'll share briefly will be an interesting way to ground myself in this space as well. I'm an EDI consultant for the BC support unit, which also means I help create and share knowledge about EDI considerations within health research. So without much ado, I'll share my screen and we'll get started.
And as Sahil is bringing up his slides, I'll mention that I serve as the EDI champion for the support unit, which is one of the areas of my work that gives me most pleasure.
Thank you, Erin. Um, I'd just like to acknowledge that I'm joining today from a hotel in downtown Vancouver. And one thing that you can't help but notice is how busy the Burrard Inlet is. There's heaps of container ships, seaplanes, sea buses, the railway, even there's gleaming piles of sulfur across the inlet. And this view has also provided us with a chance to reflect on the importance of water and how that has played a role in the history of this land as well. The Musqueam, Squamish, and Tsleil-Waututh First Nations have relied on these waters as a means of transport to, move people, goods, as well as a source of food since time immemorial. There's a saying that when the tide goes out, the table is set, and that is usually referred to the abundance of eelgrass and clam beds and lots of songbirds around the area. And most of Burrard Inlet was a mudflat in the late 1800s. And as these pictures show, this land has really transformed over the past 200 years. But the one thing that remains constant across them all is the water. And that constancy of the water as a nexus point for transportation, exchange, biodiversity, perhaps even spirituality for some, it still persists. And that's the metaphor that we're starting off our presentation with today, recognizing that we'll be working in landscapes in which things are always changing, but it is important for us to note where those constancies rely and are, so that we can take note of those values and supports to help keep us grounded in the work that we're doing. And so that's just to bring this into this space and to think about what we'll discuss. In terms of our time today, we'll share an approach that we've taken to embed equity, diversity, and inclusion, or EDI considerations into the work of the BC Support Unit and how our understanding has evolved over time as well. The main reason we hope to share this journey with you is so that we can share a couple of learnings and reflections with folks who might be interested in embarking on similar journeys in their own teams and organizations. And perhaps most importantly, to illustrate that change really extends beyond just meeting compliance standards and checking boxes, but really requires a reflection on the values that underlie this work, and also thinking about those incremental steps that we can all take in practical ways to foster equity in the spaces that we live, work, and play in. And so that's the mindset that we're hoping to cultivate through this session. I'll pass it off to Erin.
Thank you, Sahil. Love the way you present in metaphors and ground at the beginning of talks. Thank you for that introduction. It's hard to believe that we began this work in 2018. It's been a wonderful journey to be on. And over the next sort of 10, 15 minutes or so, we'll walk you through some of the major steps that we've been through during that time, starting with the patient engagement methods clusters at the support unit, through to some research projects, through to some pragmatic application of what we've learned in those research projects, into curriculum development and a series of workshops. Next slide. All of this began with Sterling Bryan. He had the vision as lead of the BC support unit over a decade ago to recognize that, we knew that patient engagement in health research was so critical and important, but we were lacking so much in terms of understanding effective methods, the science behind effective patient-oriented research. And so really took a leadership role in striking some methods clusters to focus on advancing science in a number of areas in POR. And it was my joy to be helping with the patient engagement methods cluster. And when we set out to look at the work we had to do in that space, we did a series of consultations with diverse forms of community around, what areas should we be embarking on? Where should we be striking new projects and funding different scientific areas? And the meta result from those engagements was at that time we heard that the folks that we're engaging with in research and health research just are not representative of the general population. We're lacking in diversity. And so we funded a number of projects focusing on engaging with more diverse folks in poor. And as part of that, worked with a new tool, the Tapestry tool, that we'll be talking about a little bit later, and developed a number of modules. These modules were developed for health researchers and focused on different ways and methods for engaging with folks from different communities, LGBTQ2, rural and remote, ethnocultural or newcomer communities, disabled, people living with hearing loss or deaf communities. Those are all available still, all of those modules through the web link that you can see on the bottom left of your page there. We did a scientific project as well, looking at the impact of accessing those modules on sort of, people's feelings of competencies for working with and including people from diverse backgrounds into health research spaces. And the sort of findings that we got from that project were encouraging, showing that after viewing those modules, users had a bit of more of a sense of the understanding of the tools available to them, and more confidence in feeling that they could apply those tools in their own health research settings. That's an open access paper if you'd like to read it at any point. Next slide.
And so, with these positive results from that first phase of work, as the support unit decided to embark on its second phase of work, before diving into specific EDI commitments that the support unit was going to center in its activities, there was sort of an inwards turn to look at what was happening within the unit to begin with, to understand what people thought and felt about doing EDI work in the first place, some of the assets that we already could be leveraging and that were present, areas as well where more support was needed. And this work was completed as a formal research study, actually, and data was analyzed through a method called situational analysis. And really, the way situational analysis is described is a way of making reason out of the huge plethora or madness of information that might come about. And so we were analyzing over 20 qualitative interviews from people affiliated with the unit, as well as Health Research BC, and over 60 themes were identified from this extensive data set. But we'll focus on three central themes because they've guided our efforts in this time to come. And if you're interested in reading more about this process that we embarked on to collect this data and to synthesize these findings, we have a recent open access publication as well that details how we went about this work. And that's just below there. The three themes that I'd like to hone in on have informed current initiatives that we're working on with the unit and Health Research BC. And an overarching finding from this study we conducted was that there is a great appetite to learn about EDI, to increase capacity across organizations. And people really desire structured, dedicated spaces to have conversations about EDI. Many folks have also described how this concept can seem a bit vague, at times a bit abstract, and not knowing where exactly to start from. And if you are already even working in this space, not really being able to assess whether you're doing enough or if you're on the right track. And so there was a great desire to learn about how to do EDI work and how it could fit into the day-to-day of administering and conducting health research in the context of Health Research BC. One of the interesting themes that I'd like to point out is the last one on this slide, which is the hesitancy around taking action on EDI work. People, of course, recognize the importance of doing this work and why we're embarking on these journeys, but many have also talked about the fear of doing things incorrectly, taking actions that might make it seem like they're inauthentic or that they're acting in tokenistic ways, and in some cases also inadvertently causing harm to others. And so a lot of our thinking focused on efforts to help people work on this fear. And that really required sort of an incremental step-by-step approach to build skills and knowledge, to empower people to recognize those areas where they could start to make changes, and to also support people to safely reach outside of their comfort zones and not just smorgasbord putting everything on the table. And so as you look at the next few projects we'll talk about, think about that element as you see how we've built upon this. One of the first initiatives that we ended up creating in 2023 was the EDI in Practice workshop series, which is an ongoing training opportunity offered to staff at the support unit as well as Health Research BC. And this was really designed to build a dedicated space to have discussion about EDI, to enable people to ask questions that they may otherwise be afraid to ask, to explore emerging knowledge in this field, given things are changing quite rapidly, and also to share insights across the organization, because otherwise they might be lost when we're working in silos. In terms of considerations for designing this series, workshops are not recorded and they're delivered every 6 to 8 weeks based on a gamut of areas that individuals have identified interest in building competency in. And this was an intentional choice so that we provide a safer space for people to share questions that they might have, to engage in discussions that can sometimes be messy as well. The workshops have also been designed in this sort of multi-part format so that we can focus on some underlying theory and frameworks to begin with to orient people, and then move on to more practical interactive activities as well, where people can really dive in and, start to use some of this knowledge as well. So really reframing it from being a didactic approach to more of an interactive approach. And lastly, agility has been quite important in recognizing that the organization's needs are changing, but also the EDI landscape is changing. And so recognizing that our offerings need to respond to those actively changing needs as well. So as an example, before this conference began, one of our workshops focused on the process of designing accessible and equitable in-person spaces. And some of those considerations have now informed the design of the conference as well. I'll pass it off to Erin to discuss another exciting project.
This is pretty exciting. Exciting. We're actually launching today through this conference this series of EDI modules we've been working on. Really, we've been conceptualizing these for years, but really actively working on them for the last year and a half. So this is our big reveal through this virtual session. We also have a booth running at the conference here, showcasing some of the work we're doing, and I am just so proud of the team behind this. The researchers, the people like Sahil and the team within UBC, the patient partners, the content experts that have joined us shoulder to shoulder to bring an evolving suite of curriculum and modules to you that we really hope are theoretically sort of, grounded but pragmatic at the same time, giving you access to a new suite of resources and tools to experiment with and explore in your sort of day-to-day life and context. I mentioned earlier that these are built on the Tapestry tool, which is a platform, an educational platform that we just love because it turns the idea of traditional methods of didactic teaching on its head. Tapestry is a platform that is built by Dr. Stephen Barnes at UBC for co-creation, for learning modules and preferences that are not uniform and sort of lateral, but can grow over time. And I'll show you some demonstrations of what those look like in a minute. Next slide. These are the ones that we're launching today. So we have 4 modules available now. These will continue to be built over time, but there's some great material in them already. We have a primer on EDI considerations. If you're going in to look at these modules and tools, and you might want to start with the primer, it covers some of the really foundational principles in EDI. There's a wonderful module by Dr. Janine Austin looking at EDI considerations in a research and funding contexts, looking at, as Sahil mentioned, thinking about in-person event planning and spaces by Heather McCain and how we can create really inclusive and equitable spaces. And then a module on neuro-inclusion in health research and workplaces, led by Lara McLaughlin. Coming soon, we know that metrics and measurement are really important with an EDI lens, but lots of concerns about getting that right or doing things wrong in terms of how we capture the metrics of people that we're engaging with, what we should ask, what we don't ask. So in combination with Davina and a wider team, we're working currently on developing a module on EDI and SGBA measurement. And then a module that we're also working hard on now, looking at Indigenous perspectives in collaboration with BC Near. Let's give you a little bit of a look at how these are formed. So this is what a tapestry looks like when you view it. It has different nodes, and each node you can get deeper into different concepts. It's non-linear as a platform. All types of content can be included in it. So this could be fillable PDFs, video content, slide sets, widgets, which allow you to get interactive tools like drag and drop exercises. So Tapestry gives you a way of interacting with knowledge that we think is a bit special. And it's dynamic and iterative. It builds over time. So on the left-hand side here, you can see an example of one of the widgets that's incorporated into the Designing Inclusive Event Spaces. So this is a model for how you might think about developing a wellness room. There's a wellness room at the conference here today, but thinking about what are some of the things that you might want to include in the room, some of the design features to make it feel like a safe space. On the bottom left-hand side, you can see an example of an activity to tailor personas for different healthcare research settings and other settings. And on the right-hand side is an example of a drag and drop exercise, which is actually in the neuro-inclusion module. After the presenter has given different examples of theories for neuro-inclusion, you look at the principles for them and can drag and drop to test your sort of level of knowledge of what's just been presented. I hope this gives you an idea of some of the interactivity in Tapestry. And over time, it has lots of capabilities in which we can actually look, for example, at building in, you could put in a pop-up test. So you could look at levels of competency or knowledge before somebody does one of these modules, and then test again at the end. And maybe over time, that's something that we'll consider building in as we grow them and develop them. Next slide, Theo. This is another example of another widget within the module on designing equitable in-person event spaces. So as you click onto each of these design features, it gives you really pragmatic tips and tools so that you can build your own planning documents, in-house documents for designing spaces that are really geared for inclusion and accessibility. How far should your tables be apart? Well, how are you thinking about language? There was that great question that we had earlier around moving outside of the languages that we classically capture in health settings, thinking about mobility, accessibility issues. Next slide.
Thank you, Erin. These modules are available open access and publicly as well. I've popped a link into the chat if you'd like to take a look. And yeah, we're very excited to be able to speak about them today. In terms of rounding out our conversation today, we really thought sharing some reflections on how this process has been for us would be quite useful and maybe could be some takeaways for people to think about after as well. One of the first things that we can mention here is while policy is finite, leadership is what makes this work relational. And we can create checklists of things to do. We can weave EDI considerations into processes and, how we deliver trainings and so on. But at the end of the day, this work really requires a cultivation of trust and vulnerability among teams and leaders who are willing to champion and support this work. The support unit and Health Research BC have really embraced this concept, and we're very privileged and grateful to be able to share this with them. But really, building this sort of psychological and cultural safety as we embark on this work is often challenging and it's a slower process, but it's also the most rewarding part of this work, and it really underpins our efforts here. It's also important to recognize that organizations are varied and will always have people at different levels, and so we'll have to meet them where they're at. We're never really done with training, even ourselves. We're always constantly learning in this space. And sometimes mistakes are inevitably going to be made, and we'll have to lead with compassion. And instead of calling people out, we'll call them in so that we can help people get to the same level. We're also capable of making change through our own collective efforts. It might not seem like much in the small spaces we might operate in and the small changes we might make in our work, but these are the small steps that will accumulate into larger changes within the spheres of influence we intersect with. And lastly, there's no singular answer or truth that underlies this work. We don't have all the answers ourselves. We've presented one approach to you, and there's a plethora of information and knowledge out there. And so it's an ever learning process. We're always growing as well, and we acknowledge and appreciate various perspectives in this area. The last thing that I'll end with is as you've come through this presentation, it might seem like looking at this journey from a third person's perspective, everything could have seemed logical and just made sense. It was all thoughtfully laid out, like it was orchestrated to work for success. But really, the reality on the ground sometimes is best often described by this graphic here. And we've used this several times, whereby sometimes doing this work feels like a warm day at the beach where everything is going right, the horizon is in sight. Yet at other times, it feels like you're being battered by the waves. You feel like you're slowly being pushed up the beach. You don't know where things are going. The parameters are ever evolving. There's emotions ingrained in this work. The knowledge is always changing. You can feel immobilized by this and not knowing where to begin. But really, to hark back to that initial metaphor we started with, in this changing landscape, that horizon remains the constant. It might be hard to see, but it is always there. And it allows us to reorient ourselves to focus on the things that are under our control and that we can actively work towards, however small they may be, in incremental steps. And so we hope that we've been able to present a little bit of our journey in working in this space and hope that maybe we can invite more questions and some discussion on this as well. So thank you for your time and a great privilege to be here.
Thank you so much, Erin and Sahil. I really enjoyed this session, and thank you for this reminder, looking into the horizon and also calling in and not calling out. I really enjoy the sessions that you give us during the Health Research BC session. So thank you again. We really, really tight on time, and I'm just looking if there are any questions that people might want to ask you in the chat, or people are welcome to raise their hand and just unmute themselves and have opportunity to ask. I'm just monitoring two different chats here and don't see any questions. But maybe I have a brief question here for you. We speak a lot about the learnings learnings, and I'm just wondering if you can speak a little bit about the unlearnings that we all sometimes have to do, because we've been taught to learn things in a certain way, and there is a lot of unlearnings we also have to do, especially with the indigenous cultural safety and everything what's happening in the world around us. If anyone want to just briefly make a comment, please unmute yourself.
I'll just say that from my perspective as a continual learner in this space, that humility is the grounding principle that I have to come back to again and again. And as Sahil referred to, part of that, working through that, is also about having some self-compassion, and there is no perfect state of in this EDI work. Are always times where you think I could have done something better. I didn't phrase that as I wanted, and to have self-compassion for myself during that, but to be also grounded in a continual state of humility and curiousness and openness to doing things differently and better. And that mindset for me is critical to being able to work well and to do good work in EDI.
Thank you so much. Thank you. Um, I don't see any more questions. So with that, I'm very cautious about the timing. Thank you so much, all our presenters. I hope everyone enjoyed so much as I did. And I hope you now get to enjoy the break and also connect with the rest of the attendees at this wonderful conference. So thank you very much, and hope to connect with you in the future. Thank you so much. Bye, everyone.